Do, 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 do. Do, 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 do.
Hi, welcome to Vitamin Junkies. I'm Jennifer Lyle.
I'm Dr. JJ.
And we're addicted to good health. And today we are going to be talking about digestive issues and preventing digestive issues.
Correct digestive issues. I would say about 80% of the patients who come and see me in private practice will have some form of digestive issue.
Wow. And digestion really is the key to good health, isn't it?
It is. Well, you need your nutrients to survive, and if you can't absorb correctly, and if you can't digest correctly, obviously there's going to be some health issues that are going to come from that.
Okay, and I'm going to digress, and we're going to see what JJ's taking today.
Today I am taking betaine hydrochloric acid. What betaine hydrochloric acid is hydrochloric acid, which is what we have in our stomachs to help us digest. I take this because I have some digestive issues, and I tend to under-secrete stomach acid. So I will take this usually when I take my multivitamins and before a meal.
Very good. And actually, this is a product that I've also taken on occasion to help me with digestion, because digestion is a problem for me as well. As you said, I'm part of that 80%.
Exactly.
So let's get into this.
Digestion.
What happens when we actually eat food?
Okay, so digestion begins right away in your mouth. You bite on a piece of lettuce, or in many cases, perhaps a hamburger, which I do once a month, maybe twice. Yeah, no more than twice. And you start to chew, and you right away secretes salivary amylase. So amylase is a digestive enzyme that helps you break down carbohydrates. Food then goes down your esophagus, so the tube, your food tube, into your stomach, where your food is prepared for digestion. Okay. In the stomach, you'll hit a stomach acid layer, which I mentioned before, is the which contains hydrochloric acid. And that's about a pH somewhere between 2 and 4. For those of you who remember your biology from high school, a pH of 2 and 4 will probably melt this stethoscope. Thank you, stethoscope. And so what you need in the acidic environment is it takes your proteins and breaks them down into simple amino acid. It takes your carbs and breaks them down into sugar. It takes your fats and breaks them down into fatty acids. And also the pancreas will secrete some digestive enzymes to help you digest all of these things. So proteases for proteins, lipases for fats, and amylases for carbohydrates, and other different enzymes to help you digest these things.
This reminds me of my food chemistry class in university, and I didn't pay attention then, and I wish I had paid more attention.
I just gave you the 5-minute version of it.
That's it,
right?
Exactly.
So then the content of your stomach then gets passed onto your small intestine. So you go from the duodenum to the jejunum, and then you move on to the large intestines, and then eventually, as you go through the small intestines, the body pulls out water, nutrients, minerals, vitamins, etc., amino acids. Then you end up into the large intestine, and it goes through the colon, and then eventually it's evacuated as stool. Et voila, that is digestion.
That is the journey of that hamburger.
Correct. Yes.
And
yes.
one thing to really emphasize, though, is the importance of chewing.
Oh, most definitely, definitely.
Because
right.
your stomach doesn't have teeth. So if you don't chew it good enough, then you can see chunks of food in your stool.
Yeah, you don't want to wolf things down, which I'm very guilty of doing. Yes. So.
Yes. Just earlier as well, actually. So what are some diseases of the digestive tract?
Common things I see are indigestion. So usually you'll have a meal and you'll have a little bit of pain afterwards. I'll see gas bloating. That's very common. I'll see GERD, gastroesophageal reflux disease. Oh my God, I almost lost it for a minute. Stomach ulcers, irritable bowel syndrome, Crohn's, colitis, different diseases. Irritable bowel syndrome is something we commonly see in practice. That's when people come in and they've been checked for Crohn's or colitis, which is an inflammatory disease of the bowel, and they found it's not that, so they come in with irritable bowel, which we should probably do a show on, which we will in the future, where people alternate, they have bowel pain, and they alternate between constipation and diarrhea, so it's not a very pleasant disease.
No, it doesn't sound like fun.
No, it's not pleasant at all.
So what are some strategies that we can do to ensure good digestion?
Okay. One, rule out your food allergies. My patients will detoxify on a yearly basis, And when we do a detoxification, we do something called an elimination diet.
And there's a link to an elimination diet on our website as well.
Very good. So what that means is for 7 days, you're eating a very bland diet, so none of the common allergens. And then what you do is on a daily basis, you reintroduce items from your usual diet and you see what sets you off. Most commonly, it's wheat and dairy. This is what I see in most patients. Wheat and dairy, they'll often react to. I've seen strange stuff such as iceberg lettuce. I've seen chicken. I've seen eggs. I've seen citrus. I have chocolate. There's some weird ones. There's definitely some weird ones. Soy is a very common one too. MSG, etc. So you want to remove these allergens definitely from your diet. You want to improve your digestion. So you want to make sure that when you're eating your food, you have enough stomach acid. Okay. So one important thing is when you're eating your food, make sure you're not stressed, because when you're stressed, producing gastric secretions is not at all important to the body. Your body is focused on short-term survival, which is basically blood to your muscles and so on. So it's not focused on digestion. So take a few deep respirations, breathe, try to calm yourself down. Some things I give to patients are betaine hydrochloric acid, just to get your stomach acid going. Some patients will take apple cider vinegar. They'll take a little swig.
Yes, I do that. And that is really good because if you have overactive stomach acid or underactive, it balances it out. Is that right?
It's not so much that it balances it out, is that the acidity when you take the apple cider vinegar helps to close the lower sphincter of the esophagus.
Okay.
And a lot of people that have GERD, Jen's talking about GERD, so when you have acid climbing up your esophagus, it's usually because the contents in the stomach aren't acidic enough to close the esophagus, but acidic enough to cause pain if the contents get backed into it. So what you do is if you acidify and close that lower sphincter, it usually fixes the GERD problem. I have very good results with GERD. I see GERD in tons of cases, from pregnant women to obese to normal people with GERD. It's a pretty common one out there.
Oh,
yeah. Good sources of fiber. We want regular bowel movements. Lots of water for bowel movements.
What's regular bowel movements?
Regular bowel movements is 1 to 2 a day. 1 to 2 a day, regular bowel movements.
I thought it's 2 to 3, no?
I go 1 to 2.
Wow.
Oh, that would be even better. The more the merrier. You want to evacuate as long as it's not, evacuation every hour or so. But it is, 1 to 2 is usually what I aim for. Some people say, oh, I'm regular, and I ask them, and they say, okay, well, what's regular to you? And they'll say, oh, once a week. I said, no, that's not regular. That's not regular. Good sources of fiber, lots of water I talked about. Also, supplement-wise, probiotics are very good for helping your digestion, cutting down your bloating. In some cases, more so as people age, as we tend to have less digestive secretions, I may put patients on a digestive enzyme, so that may be something to consider. But you'd want to check with someone like me, a naturopathic doctor, before, just because I want to make sure, we might be able to fix something else, maybe fix your diet before we put you on a digestive enzyme.
Perfect. So it's really important to work with a healthcare practitioner to help you figure out what is the best approach for you. And you can find a naturopathic doctor on the Find a Practitioner link at www.vitaminjunkies.com. And while you're there, you can also join the addiction and subscribe to receive our weekly podcasts.
Yes, ma'am.
That's all.
That's it. Digestion, healthy digestion.
Here's to number 2s.
Here's to number 2s. I'm Dr. JJ.
I'm Jennifer Lyle, and continue the addiction to good health.
Do 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 do. Do 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 do. Do 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 do. Do do do.